pregnant woman requires a balanced diet. A iron-rich diet. It should have carbohydrates, proteins, fats, vitamins and minerals. A iron-rich diet because of the increased demands of the pregnancy. Iron-rich diet would include meat, poultry, fish, eggs, dark green leafy vegetables, jaggery, groundnut, lentils. A high protein diet would include pulses, legumes. Horse gram is the richest protein on this planet, and vitamins, which includes all fruits. Minerals would be obtained from the dry fruits. In primigravida, that is first time pregnant, usually the baby moves by around 20 weeks. But in a person who has already had a previous pregnancy, they would feel the baby move at roughly around 16 to 18 weeks of pregnancy. When we are doing good and we are fine, we go about doing our routine activities, we move around. But when we are sick, we apply leave, we take rest, we refuse to move, we conserve our energy. Similarly with the fetus. When it is a healthy fetus, it is active, it keeps moving around. But when it is sick, it refuses to move, it conserves its energy. So, the mother has to keep a watch on the fetal movements. It has to be at least 10 movements in 12 hours. If less, contact your doctor immediately. No, it is not normal. Cramps and light spotting could be a feature of a miscarriage which is threatening, or it could be an ectopic pregnancy, that is pregnancy outside the uterus. On an urgent basis, contact your doctor immediately if you see any spotting and cramping. During your prenatal checkups, your doctor will be assessing the mother and the fetal health. So your concerns are heard, solutions are given, and on examination wise, doctor will be looking at your pulse, blood pressure, weight, and assessing the uterine size, the fetal growth, the fetal heart rate will be recorded. And investigations wise, doctor will be doing your periodic blood checkups, ultrasound would be suggested and reports would be evaluated. So how often will you need them? During an uneventful pregnancy, 10 antenatal checkups are required. First 7 months, monthly once, followed by next 2 months, once in a fortnight, last month, weekly once. However, if it is a complicated pregnancy, then your doctor will call you more frequently as and when required. Now, in a normal uneventful pregnancy, we do 5 ultrasound scans. These are precise targeted scans. Early pregnancy scan, we do it to know whether it is a single or a multiple pregnancy, whether the pregnancy is inside or outside the uterus, the fetal heart rate, is it present or absent, and also to begin with, is the uterus and tubes normal to begin with. Now the second scan would be the NT scan. This is basically for Down syndrome screening. The third is the anomaly scan, which is done at 5th month, wherein we know whether the baby's heart, head, limbs, etc. are all normal. The 8th month scan is the interval growth scan. The last scan, the 5th scan, would be the fetal weight and the biophysical profile. It's a fetal well-being test which is done very close to delivery. However, if it is an complicated pregnancy, your doctor would be doing more scans. Yes, these supplements are required. In the first 3 months, we give what we call as folic acid. This prevents fetal neural tube defects. After 3rd month, we give hematinics and calcium. The iron is given because there is increased demand due to the pregnancy. There is increased blood supply and also because of the fetal growth and development. The calcium, the baby's bones are formed and it takes away all the calcium from the mother. Hence, to prevent these aches and pains in the mother, she has to supplement herself with calcium. In the initial part of pregnancy, you can sleep on your back. But As the pregnancy advances, it is important that you lie more on the left or the right, more on the left lateral position. This is because it increases the blood supply to the baby and improves the fetal growth. Yes, it is safe to have sexual intercourse throughout pregnancy. The first 3 months and the last 3 months, one needs to be careful. The partner's weight should not be falling on the pregnant tummy. A woman on top position would be more advisable. However, if it is a complicated pregnancy like low-lying placenta or a bad obstetric history, your doctor may suggest sexual abstinence. Paracetamol, that is Dolo 650, is safe in case you have any aches and pains and fever. Local painkillers like Volini gel, TRP gel, they are safe. Rest of the medicine you will have to contact your doctor and take. Unlike non-pregnant women and men, the pregnant women, due to the fetal weight in the front, leans backwards, which we call as lordosis. So invariably there will be some back pain and discomfort. To relieve it, one can take rest. 2. Hot water fomentation followed by a local analgesic ointment. If still the back pain persists, one can take paracetamol, that is Dolo 650. In case it still is not relieved, then you can bring it to the notice of your doctor. The swelling in the feet is due to 2 causes. 1. It is due to a normal pregnancy. 2. If there is high BP during pregnancy. So, swelling of the feet will come down if you put pillow below your legs when you sleep. 1. 2. On rest. If it is normal in pregnancy, following rest, for example, early in the morning, the swelling would have reduced. However, if there is high BP, in spite of rest, the swelling will not subside. So, on control of the BP, the swelling of the feet would reduce. A woman can go into labor after 37 completed weeks. The signs of labor are: 1. Labor pains. Labor pains initially are like severe period pain. It comes from the back to the front. It is typically intermittent. It is not continuous. As the pregnancy progresses, the intensity increases, the frequency also increases. 2. Leak per vaginal, that is if there is watery discharge from your vagina. 3. Reduced fetal movements, less than 10 in 12 hours. 4. If a woman has reddish discharge, this may be a sign of early labor. Any of these signs, please contact your doctor and come to the emergency department. After normal delivery, a woman can start exercising after 1 month. After cesarean, she can start exercising from 3 months. It is important to lose all the pregnancy weight that she has gained by the time the child is 1 year old. It is now or never. 2. About the tummy trimming. A woman has to seek help from the doctor who will be giving her a chart, or she will be referring her to a physiotherapist who will be teaching her tummy trimming exercises. It is important for a woman to lose the weight that she gained during pregnancy by the time the child is 1 year old. Otherwise, this weight will be the baseline weight for the beginning of the next pregnancy. Breast milk is the best milk. It is very rich nutritionally. 2. It has antibodies which prevents infections like gastroenteritis. Also, it has been seen that breastfed infants are at less risk for asthma, cancer, obesity and diabetes. For the mother, breastfeeding also has its own benefits. 1. It reduces the incidence of breast cancer and ovarian cancer. 2. It helps her to lose weight and get back to shape. To prepare for the breastfeeding, in case a pregnant woman notices any changes in her breast or nipples, like retracted nipples, it is important to bring it to the notice of your doctor so that it is corrected by the time she delivers the baby. Following the birth of the child, you feel low mood, crying spells, anxiety with your partner, irritability, lack of sleep in the night, feeling sleepy all day, not having the bond with the baby, having fear that something bad would happen to the baby, or in case you have any thoughts of harming the baby or suicidal thoughts, self-harm thoughts, please come to your doctor immediately. Then your doctor would be then putting you on to a team of mental health experts who include the psychologist, who will be giving you therapy sessions, and the psychiatrist if need be. Mind you, postpartum depression is treatable. Vaccinations are allowed in pregnancy. The inactive vaccines are used. The live vaccines are not used during pregnancy. The vaccines that we normally recommend during pregnancy is 1. The tetanus toxoid, the TD, which acts against tetanus and diphtheria, the Tdap, which protects you against tetanus, diphtheria and pertussis, and the flu shot. Got more questions? Check out our playlist for more expert pregnancy advice.